This is Med School Radio. Hello again, this is Simon in Tokyo. We're just going to have a very simple review looking at medbullets.com, looking at their USMLE Step 1, Section 4, Duchenne and Becker Muscular Dystrophy. So we're just going to read through the list very simply, and this could be a useful way for you to prepare for your exams. Very simple here. So let's give that a try and see how it goes. So first, a snapshot is given. A 4-year-old boy is brought to his pediatrician by his mother for muscle weakness. She reports that he has trouble running with his friends and climbing the stairs. She also states that the patient has increased difficulty arising from a seated position on the ground and walks in a waddling way. On physical exam, there is significant proximal muscle weakness and pseudohypertrophy of the bilateral calves. He also has Gower's sign. Laboratory testing is notable for a significantly elevated creatine kinase and aldolase. A sample is obtained for genetic analysis of the dystrophin gene. So think about that for a second. So continuing on, we're just going to go through the bullet points list. It's going to be a little dry, but it's a great way to review. It makes you think about these main points for this if you're going to take an exam. First, clinical definition. Inherited disorder of skeletal muscle leading to progressive muscle weakness. Epidemiology. Incidence. Duchenne muscular dystrophy, the most common early onset form. Becker muscular dystrophy is a relatively common form that typically presents later in life. Demographics, male children. Recall that males have only one X chromosome. Etiology, X-linked recessive mutation in the dystrophin gene. Duchenne muscular dystrophy, frameshift or deletion of the dystrophin gene, results in complete loss of dystrophin. Becker muscular dystrophy is non-frameshift, results in partial function of dystrophin. In other words, the reading frame is not disrupted. Next, pathogenesis. Normal biology. Dystrophin is one of the largest human genes and appears to be involved in preventing muscle fiber degeneration by providing mechanical stability between the myofiber and its cell membrane. Next, connecting actin to alpha and beta dystroglycan transmembrane proteins. Cell signaling. And dystrophin is expressed in cardiac, skeletal, and neural tissue. Next, pathology. Absent or decreased function of dystrophin leads to cycles of muscle fiber degeneration and regeneration. This subsequently leads to fatty replacement and a distorted fascicular architecture. The prognosis. For Duchenne muscular dystrophy, the mean age of death is 25 to 30 years of age, and death results from heart failure or respiratory failure. Next, Becker muscular dystrophy. Less severe than Duchenne muscular dystrophy. Presentation. Symptoms: progressive muscle weakness, most severe in the proximal muscles and lower extremity. Waddling gait. Physical exam: Gower's sign. A patient using their upper extremity to stand signifies weakness of the proximal lower extremity muscles. Calf pseudohypertrophy. Lumbar lordosis, hypo or areflexia. Next, studies. First, the labs. You would see an increased serum creatine kinase, and an increased aldolase, alanine transaminase, and aspartate transaminase. Genetic testing confirms the diagnosis. Dystrophin analysis. Duchenne muscular dystrophy. For this, there would be complete or almost complete loss of dystrophin. For Becker muscular dystrophy, dystrophin with abnormal molecular weight, or reduced quantity of dystrophin. As for the biopsy, muscle fibril degeneration, regeneration, and isolated fiber hypertrophy, muscle replacement with fat and connective tissue. Performed if genetic testing is negative. Take a biopsy. What is the differential? Limb girdle muscular dystrophy or spinal muscular atrophy. I think we're going to do a show on spinal muscular atrophy later. Treatment. Management approach. Treatment for both Duchenne and Becker muscular dystrophy is multidisciplinary to manage symptoms and complications. Medical. Glucocorticosteroids. The indication, mainstay of treatment for patients with Duchenne muscular dystrophy. So remember, glucocorticosteroids. Drugs, prednisone or deflazacort. Adverse effects, weight gain, hirsutism, Cushingoid appearance. Complications, you could have, for muscular, you could be wheelchair bound, or as for cardiac, dilated cardiomyopathy, or arrhythmia, and orthopedic, fractures secondary to falling. So those are the basic bullet points for Duchenne and Becker muscular dystrophy. So thanks a lot for listening to that.
This is Med School Radio.